This is the 10-step protocol meditation. So I'd like you to start by laying down on your bed or a massage table. Taking a nice deep breath, and when you exhale, let your body settle deeper and more relaxed into the table or the bed. So you're going to start at the feet, gently placing your hands on the ankles, grounding, pulling your energy back, quieting your mind, and just allowing the cranial rhythm to come into your awareness. It may feel like a gentle wave or a gentle breath as the body externally rotates for flexion and internally rotates when it goes into extension. After a few rhythms, when the body next goes into extension at that end point, just hold and put that system into still point. And when the rhythm has come back on, you can take your hands off and take your stool or chair and move to the side of the body next to the sacrum. You're going to slide the hand that is closest to the feet under the sacrum. And just taking a moment to check that your hand is relaxed, not gripping. And let that sacrum fall into your hand. Noticing how it feels. Does it feel heavy or light? Is there movement? Is it very rigid? Now place your other hand on the top of the body, butting up to the pubic bone. For the pelvic diaphragm release. So with just a very gentle pressure, you're going to take that top hand down in the system, down in the body, towards the table. If you encounter resistance, you're using too much pressure, we just allow it to be taken in as far as it wants to go. And when we hit that wall or that end point, we're going to lift with gentle traction up towards the ceiling. Releasing any minor restrictions within that pelvic diaphragm, letting it relax, expand. Now you can remove your hands, slide the stool up a little bit towards the head. We're going to do the respiratory diaphragm. Your top hand will be butting up against the sternum, and your bottom hand will be directly below it. We're going to do the same procedure, same technique. So let that top hand be drawn inward. And when it feels like it doesn't want to go any further, intend to bring that up, up, up towards the ceiling. Okay, we're going to take our hands off, out from under. The next one will be the thoracic inlet. Our top hands will be at the collarbones. You can use your whole hand or your thumb and your fingertips. Your bottom hand will slide directly beneath, right at the top of the body, right below the neck. So we're not on the neck, just below it, between those shoulder blades. And same technique. Allow that top hand to be drawn inward. And then as that thoracic inlet expands, opens up, relaxes, the top hand will come up and out. And you can take your stool to the head of the table for the hyoid bone release. With this one, we do not compress, we only decompress. With the finger from each hand, contact the jaw so the system knows we're there. Gently sliding down to the hyoid bone at the throat. And we're going to decompress. Very gentle, light traction, light fingertips, light pressure. We're going to decompress at about a 45-degree angle up towards the ceiling. We're going to move on to the cranial base release. This is a 5-step technique. For the first step, we're going to slide our hands gently under the occiput, so we're supporting the head. We're checking that the chin is not tipping towards the chest. We want that neck in a neutral position. And our fingertips are going to contact the tissue between the occiput and C1. We're going to use enough pressure so that it knows we're there, but not enough to create resistance. We're going to wait for that tissue to start softening, lengthening, moving out of the way. And then we're going to bring our fingertips straight up, up, up into that space. So sliding the hands towards the shoulders a little bit. Fingers straight. I'm going to wait for more softening and lengthening. And then step 3, with a finger from each hand, you're going to find that atlas, which is C1, stabilize it. I usually use my middle finger from each hand, and with my ring and little fingers, a gentle traction of the occiput towards your sitting body. Creating space between the head and the neck. Now you're going to take the finger away from the atlas. We're going to do a gentle attraction laterally of the condyles, those bumps at the base of the skull. So traction laterally, pulling them out to the side. Letting them come back to center. Now relaxing your hands so the head is just resting in your hands. I'm going to stretch the dural tube so we can imagine that we have a rowboat with a long rope, and we want to pull it very gently through the water with our little finger. That's the amount of pressure we'll use, so we're going to start with almost nothing and go up to about 20%. So just gently holding the head and intending to not engage the muscle or the tissue, but just the dural tube. Stretch, 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 pulling gentle traction, the head towards your sitting body. And letting it come back to center. Now you can go back to the sacrum. Take your stool back to the sacrum. Sliding the hand that's closest to the lying body's feet under the sacrum. And with the other hand, slide it under the lumbar spine. It's usually where the dip in the back is. And you can tune into flexion and extension, which in this position will feel like the sacrum and the spine are gently floating up towards the head. And down towards the feet. And we remember that the cranial rhythm is at least 3 seconds long each direction. Now we'll stabilize the sacrum, gentle traction of that lumbar spine up towards the head. Letting it come back to center, stabilizing that spine, gentle traction of the sacrum down towards the feet. Letting it come back to center. And keeping that hand under the sacrum. We're going to move to the iliac gap. Release, so that hand under the spine is going to come up and out. And we're going to contact the superior anterior iliac spines So those hip bones, with our fingertips and our elbow, and we're going to intend to bring them up and together towards the ceiling, creating more space for the sacrum behind. Now with that top hand, you can slide it under the neck and just butt the hand up, or the fingers up to the occiput for a nice dural tube rock. So again, tuning into the flexion and extension. As both the occiput and the sacrum flow up towards the head. And down towards the feet. Now stabilize the sacrum, gentle traction of the occiput up towards the top of the head. Letting it come back down. Stabilize the occiput, gentle traction of the sacrum down towards the feet. And letting it come back to center. You can remove your hands, bring your stool back up to the head of the table or the bed. We're going to do the frontal bone release. So we're going to use our finger pads, not our fingertips. Very gently placing them, both hands just above the eyebrows. We're going to check our shoulders are relaxed and our touch is very, very light. It's easy to get heavy from this angle. We're going to do a gentle traction lift technique. And in the process, that bone may need to do some unwinding. That's okay. We're going to intend to bring that frontal bone up towards the ceiling. Releasing any restriction or compression within the sutures or between the bone and the membrane beneath it. Now for the parietal bones, you're going to rest the side of your hands where your little fingers are on the table. Your fingers are going to be together and your finger pads are going to contact those bony ridges on either side of your head near the top. Very relaxed, light touch. Two-step technique. First step, gentle compression medially. So fingers are going to feel like they're coming together. There's going to be kind of a rebound effect, so they're going to go inward medially as far as it wants to take you, and then they're going to very kind of slow motion bounce laterally outward. And when you feel like those parietal bones have gone as far laterally as they're going to go, you're going to hold them open for 10 seconds. creating more space for the venous sinuses. And without changing your hand position, now you're going to gentle traction the parietal bones up towards your sitting body. And again, holding open for 10 seconds at the end point. Now we're going to move on to the sphenoid bone. Our thumbs are going to be at the temples. Our fingers just very lightly resting around the side of the head to the occiput. As we tune into flexion and extension in this position, it's going to feel like our fingers and thumbs are coming together and spreading apart. And now we're going to stabilize the occiput. And we're going to use the cupboard technique where we need to push the cupboard in order to open it. So with our thumbs mostly in tension, we're going to bring that sphenoid down towards the bed or the table so that it can release and go up towards the ceiling. Now moving on to the temporal bones, we have two assessment techniques. The first one, we're going to put our middle finger in each ear. Our first finger is going to be laying directly in front of the ear, and our third finger directly behind the ear on that bony ridge. We're going to look for a rocking motion, rocking forward and backward, noticing if there's symmetry, amplitude. With our next assessment technique, we're going to slide our hands completely under the head, and the sides of our thumbs are going to be laying directly behind the ear on those bony ridges. And this is the temporal wobble, so we're going to ask that temporal bone to slide side to side, again looking for symmetry and amplitude. And for the treatment technique, we're going to put our thumbs in the ear, grasping the ear with our fingers. Gentle traction at about a 45-degree angle out and towards the floor, the angle of a tent. We're going to do it slow and gentle, slowly building up to about 20% physical traction. If we do it too fast, we're just going to be pulling the skin. Releasing any restrictions within the sutures or the membrane. Now we'll move on to the TMJ. So with a finger from each hand, find that little dip in the cheeks. And with this technique, we intend a little compression, gentle compression towards the jaw, towards the joint. Decompress, following the line of the jaw up towards the ceiling. When you hit that end point, you're going to just take it straight up. So one more time. Compress towards the jaw joint. Decompress, following the angle of the jaw up towards the ceiling. And when it doesn't want to go any further, just a little nudge straight up towards the ceiling. And now for cranial pumping, we're going to place one hand under the occiput and one hand at the frontal bone. Fingertips of both hands, or fingers of both hands, are pointing in the direction of the feet. We're going to tune into flexion and extension from this position. That's going to feel like the fingertips of both hands come together, and then the heel of both hands come together. And at the end point of each direction, we're just going to give it a little nudge. Okay, you can remove your hands from the head. Go back to the feet. Place your hands on the ankles very gently. Tune into the flexion and extension one more time. And you might notice if the amplitude or symmetry has changed. At the end point of extension, put that system into still point once more. When it turns back on, you can take it through one more cycle or two. And gently take your hands off. Consciously disconnect. And when you're ready, you can open your eyes.